CCG overturn a multidisciplinary team's recommendation following assessment?
Unfortunately, this is something we're increasingly encountering, that people have approached us at a latter stage where they've actually undertaken the decision support tool themselves, unrepresented. The multidisciplinary team have recommended that continuing healthcare funding is put into place, only for correspondence to later follow telling them that they haven't received it, and that further to a panel being undertaken or a ratification, the decision is that the individual doesn't have primary healthcare needs. Now, this is unacceptable, and the national framework makes it very clear that it's unacceptable, save in what they class as exceptional circumstances, supported by clearly articulated reasons. So a decision not to accept a multidisciplinary team recommendation cannot be made unilaterally either, and that is a real danger, because you could have one individual as a sort of gatekeeping exercise reviewing these decisions and going against the recommendation of a multidisciplinary team of professionals, which clearly isn't acceptable. So in essence, yes, in theory it can be the case that a decision of an MDT is overturned. However, it should be the exception and certainly not the norm, and it has to be for clearly articulated reasons. Now, the CCG may ask for further work to be undertaken, and this is something that we're increasingly encountering as well. Now, clearly, if the decision support tool assessment has been correctly conducted and significant volume of evidence has been gathered and put within the decision support tool assessment to justify the rationales for a particular level of need and why somebody meets the criteria for funding. Again, it simply wouldn't be acceptable for the CCG to not award the funding and simply send it back for further work to be done. Further work should only be asked for if the decision is flawed. So, for example, evidence given in support clearly contradicts the level of need being put forward as agreed. I'm being facetious, but for example, if somebody was given a high level of need on the basis that they had a high risk of falls and a number of falls history, so a large number of falls, and the evidence put forward to support that high level of need was that the person was completing 5k runs on a weekend, clearly the two would not marry, and that would be a prime example where further evidence would be required, justifiably sought by the CCG, to evidence the level of need that had been given. If the evidence is there, so using that same example, a high level of need has been advised for mobility, and the evidence given in support is the care home's risk assessment, which clearly shows that the individual is at high risk of falls and the rationale behind that, and there is a falls history, and the evidence given is the number of falls within the last 6 months by date and the circumstance, then it would be completely unreasonable for the CCG to say that further evidence needed to be gathered to support the level of need. It cannot be an exercise in delaying awarding funding in the hope that an individual's needs resolve between the date at which the assessment was undertaken, or indeed improve, and a latter point, at which point they could say, aha, there's been an improvement, and therefore there's no evidence to support the initial findings, when in fact, at the point in time the initial assessment was undertaken, there was more than sufficient evidence to meet the need. Now, this is one example of the sorts of issues that individuals can encounter when partaking in the what we suggest in our experience is a complex process of assessment. It's a matter of knowing the ins and outs of the national framework and how it works and how it should be implemented. And because as a lay individual, a family member, why should they know that what they're being told is incorrect? It's simply something they should have had generally no experience in undertaking, and they're not to know whether what's being done has been done correctly or not. That is why we feel that there is a very real justification and benefit in having an expert such as Compass CHC in your corner, fighting on your behalf to ensure that where an individual meets the eligibility criteria, they receive the funding they're entitled to as swiftly as possible, and to make sure that where that funding has been awarded, it remains in place for so long as they are entitled to it. And this is one such example of where individuals can come unstuck when unrepresented. Now, we'd be more than happy to discuss any aspect of continuing healthcare with you if you have any queries or how it applies to your particular relative circumstances, or indeed just in more general terms as to how it all works. We do offer a completely free, no obligation and strictly confidential phone assessment where we'll be more than happy to direct one of our experts to go through matters with you. Our phone number is 0121 227 8940. Equally, we are available via our website on www.continuing-healthcare.co.uk. There is a wealth of information about continuing healthcare funding there, both in written form and in video blogs such as this. And if you have any queries, please do not hesitate to contact us and we'll be happy to assist. Thank you.